what I do, and it's just pretty hectic because dealing with emergency, you never know what is going to happen. It could be happening with the emergency here. We are very busy, but also with the athletes. I mean, they can have problems. Usually, we have a lot of problems with wisdom teeth, and a lot of problems with root canal pain, and things like that. But they keep me busy. Okay, anybody wants to ask? Yes.
How did you refine that your two specialties? Like, how did you go from endo to also looking at?
Well, I always like endo because, like I said, in emergency, most of the emergency pain, and when you are a dentist, you're going to encounter that in your private practice. Endodontic pain or dental pain, most of the time is due to bacteria. Bacteria start creating an infection, and then when the infection starts, then you have two choices: either doing a root canal or taking the tooth out. The advantage of a root canal is that you save the tooth, and the patient keeps the tooth. The disadvantage, if you're doing a root canal on a posterior or a back tooth, after you do the root canal, you gotta rebuild the tooth, and then you have to place a crown. Otherwise, the tooth will crack; they will fracture later on. So to me, it's for what we do here at USC. Being an endodontist is a perfect fit, and also dealing with athletic and sport-related injuries. You could be either an endodontist or you could be also an oral surgeon. Will deal with that, but the advantage of the difference between an oral surgeon and endodontist, I mean, the training for oral surgery is a lot more. I think you need to go either 4 years and then you go to the hospital. So I mean, if you like that, that's one way to do it, but it's a lot more time. Okay, anybody else has any other question?
I have a question.
Yeah.
So for sports medicine, does that cover, well, obviously it covers the teeth, but does it cover the craniofacial bones also?
Well, yeah, it covers it. When the sport medicine team at USC it's a large staff. We have probably, if you are all the doctors in there, we are probably about 20, 25, and that covers anything related to any type of injury that can happen to a student athlete. It could be a problem with the ankle, with the knee, and the area where my area is with the mouth, with the face. Usually we see a lot of lip lacerations, a lot of tooth avulsion, that the tooth gets knocked out, tooth fractures, and a lot of problems dealing with wisdom teeth. The wisdom teeth is more like the wisdom tooth start coming out and needs to be extracted and create what is called pericoronitis. It's an infection, very painful. It usually happens when you are between 17 and 20 years old in that age, and then the treatment is to remove the teeth. Does that make sense?
Yeah, definitely.
Yeah, but it's basically most of the injuries that we see here in terms of the teeth, it's like fractures and a lot of lip lacerations and tooth avulsion. That's about it. Yes.
Do you get to travel with the team?
Yeah, I travel with the team.
Do you get to go to all their away games?
Yeah. Basically, with the team we have about, that we travel, we have a cardiologist, a couple of orthopedic surgeons, me, and then we have the athletic trainers and.
You guys haven't seen him. Dr. Rubens is always on the side.
Yeah, I get to go on the sideline. Plus, I also work with the basketball team. But the advantage of with a smaller team that the basketball team is we don't have that many injuries. Even though basketball, to tell you the truth, if you compare the number of athletes in basketball is a very advanced contact sport because most of them they are not wearing any type of protection. So sometimes you see very extensive injuries during the basketball game. Anything else?
Do you take any of the residents with you on the trips? Or
No, it's just basically, it's due to the NCAA rules, when we travel, we can only take, I think it's like for Pac-10 games or Pac-12, we can only take like 60 or 65 players. And usually what we do, we travel the day before, play the game, and then the same day from the stadium we come back here. So it's nice. I've been doing it so long that now it's kind of tiring, because sometimes we get back at weird hours. If we play, let's say, at 9 o'clock in the East Coast, by the time we get here it's at 4 o'clock in the morning. It's very, I mean, or 5, so it's not and then we don't stay the night. We usually fly back the same day. No.
Have you ever had to deal with any emergencies like while you were away?
Yeah.
Where do you take them?
Well, usually we work on them. If it's something simple, we work on the hotel. Because the hotel is like we have all the equipment, we move all our stuff in the hotel. Basically, when we get to a hotel, we control like a whole wing of the hotel. We have several of those rooms, and we have one for the training headquarters, and we have all the equipment that we could use there. I'll tell you a funny story, like about what was that? Like, I don't know. I think it was, I forgot, about 7 or 8 years ago. We were traveling to play Notre Dame. We were flying to South Bend over there. I mean, I think we stay in Michigan City. That is a small city outside South Bend, because at that time Pete Carroll, he doesn't like to stay close to where the other team is, because we don't want their fans or the people to bother our players. So it was we were flying, it was late, and I remember as soon as it's a long flight, it's like about 5 hours to get there. All of a sudden it was kind of raining, and it was a very bumpy flight, and we were very close to South Bend. We're probably like about an hour or 45 minutes away. I remember the pilot says, "You know what? This doesn't look too good. We may have to go land in Chicago, because the turbulence is very rough, and this may be a rough landing." So everyone said, "Oh, okay," but I noticed it was bumpy. All of a sudden, he said, "Well, we're gonna try to make it." And the plane all of a sudden like dropped, like a huge drop. I remember like in some of the players, their seatbelt broke, and they end up hitting the roof. And I remember like I had my cell phone on my pocket. All of a sudden I couldn't find it, and I lost it. I got to, and then one of the doctors that I seen in one of the operations goes, "What happened?" I go, "Well, I cannot find my cell phone." He goes, "Well, why don't you call it?" I go, "Are you kidding me? When you're on the plane, you disconnect it. You put it off. I mean, you cannot call the phone because it's off. You know." So basically, one of the players found it like about 10 rows in front. Then that was then we land, and then when we land, I noticed like Pete Carroll, he's spacing himself in front of the plane, and as soon as I get out, he goes, "Doc, come over here." And I go, "What's going on?" He goes, "Well, when we go to the hotel, can you take a look at Lawrence Jackson?" At that time, Lawrence Jackson was one of our defensive end. I go, "What happened to him?" He goes, "Well," he told me, he had like a popsicle in his mouth, and because he dropped, he got stuck in the back of his throat. And basically, when we got to the hotel, I was able to get it out and clean it, and it was basically pretty deep on the side of his head. So I mean, but that wasn't sport related, but it was related on the trip to a sporting event. So that was a funny thing there. I have another funny one was like I think the year before. I was here minding my own business, and one of the trainers called me, "Hey, you better come here to Howard Jones Field. We need you right now." I go, "Okay." So I got there, and at that time we were doing like, it was supposed to be a passing drill, 7-on-7 between USC and some players from El Camino College. I mean, they were in practice, and at that time we had one of our players. We had a linebacker that he was deaf. He couldn't speak, and for whatever reason, he collided with another one of our players. And I mean, that's what I shouldn't laugh. Two of his front teeth were stuck on the head, on the skull of the other guy. I mean, the teeth were stuck. And the deaf guy, I couldn't understand what he was saying, but I could make up that he was using the F word, you know, like, I could say, oh, that's what he meant. So basically what I gotta do, I took those teeth from the guy, I kind of replanted on the deaf guy. I had to get a numb and all that. Eventually I had to do root canals on his front teeth.